Okay, imagine this for a moment. Imagine feeling just utterly exhausted, but not physically, like mentally paralyzed.
Yeah.
You can't focus, can't think straight, maybe can't even finish a sentence. But your body feels fine, maybe even strong. You could, I don't know, go for a run, lift some weights, do hard physical work.
Right.
But your mind is just fog, total fog. And here's the kicker. What if just thinking or even talking makes it worse, pushes you deeper into that mental swamp?
It sounds like a complete contradiction, doesn't it?
It really does. Like a cruel paradox. Your mind's given up, but your body's still ready to go.
Absolutely. And that paradox, that's exactly what we're diving into today. It's the absolute heart of this state.
Okay.
Our deep dive is into this really fascinating, often misunderstood human condition. We're looking at it through the lens of Phosphoricum acidum, based on these incredibly detailed historical and clinical sources you shared.
Yeah, they're quite something.
They really are. And this isn't just about, a specific remedy name. It's more like a unique way of understanding a certain kind of debility, how deep grief can show up physically, and these really intricate, sometimes completely counterintuitive links between mind and body.
So we're mapping it out.
We're going to trace the whole progression, how it starts with that mental fog, that overwhelming brain tiredness, and how it then moves into these, often quite peculiar physical symptoms. And along the way, we'll uncover some really surprising ways the body tries to cope, finds these weird kinds of relief.
And for you listening, this deep dive, it's meant to be more than just a summary. Think of it as a shortcut, really. A way to get a much deeper, more nuanced understanding of this really complex, very human state. Something that maybe gets brushed off as just being tired or a bit down.
Right, without seeing the specific pattern.
Exactly. We're talking about insights into how these really profound emotional states, these mental struggles, can actually physically manifest with incredible precision. And crucially, how sometimes relief doesn't come from where you'd expect at all. Maybe even the opposite.
It could really shift how you think about exhaustion.
It really could.
Yeah.
It might just change how you view weakness or recovery altogether.
And the sources we have today are just fantastic. So rich, so granular. They paint this incredibly complete picture.
Yeah, not just lists, right?
Not at all. These are detailed clinical observations, almost like mini case studies. They track exactly what makes things worse, what makes things better, the aggravations and ameliorations. And what's really valuable is how they draw these comparisons to other conditions, other remedy profiles.
Highlighting the differences.
Precisely. Those subtle but crucial distinctions that help us zero in on the unique signature of Phosphoricum acidum. It lets us build this vivid, almost three-dimensional understanding of this specific human profile.
Okay, let's dive right in then, because the first concept you said is the most defining one.
It really is. The core idea, the thing that immediately sets Phosphoricum acidum apart, is that the mental weakness, the mental debility, it appears first, often way before any significant physical weakness shows up.
Okay.
The sources hammer this point home again and again. It's like the key diagnostic signpost.
Right, so it's not just feeling a bit mentally slow because you're physically sick.
Exactly the opposite, in fact. And it's worth really digging into what mental enfeeblement means here. It's not just, I didn't sleep well.
Wow.
No, it's a fundamental exhaustion of the mind itself. A deep weariness in the very capacity to think. The person might seem obtuse, slow on the uptake, dull-witted, and torpid, which means sluggish, lacking energy, almost like their thoughts are moving through thick mud.
Wow, that sounds heavy.
It is. Imagine trying to process simple info when your brain feels like it's wrapped in cotton wool, fighting against some invisible resistance. And when you ask someone in this state a question, they answer really slowly. Reluctantly. Or sometimes they don't answer at all. They just kind of look at you, maybe with glassy eyes, not really comprehending. The sources capture this so well with a direct quote. It really hits home. Don't talk to me. Let me alone.
That sounds almost harsh, but you're saying it's not.
It's not rudeness. It's this deep, almost desperate plea from a mind that's completely overwhelmed by the sheer effort of processing anything external, even just a simple conversation. It's a profound exhaustion of the core mental faculties.
Okay, and this is where it gets really weird, right? The contrast?
Yes, this is the fascinating counterintuitive bit. The sources are really careful to contrast this initial mental collapse with other states. Like they mention muriatic acid.
Okay, what's the deal there?
With muriatic acid, it's the muscular prostration that comes first. Your body feels like lead, totally drained, but your mind, still pretty clear, thoughts are sharp.
So the opposite.
The complete opposite.
Yeah.
For Phosphoricum acidum, the person might genuinely feel, believe it or not, physically vigorous. Yes. They might be perfectly capable of physical work, even strenuous exercise. Maybe they even feel this strange, restless energy in their body. But their mind, utterly, completely drained.
So what does that tell us? That inverse relationship.
Yeah.
It means debility isn't just one thing, is it?
It tells us we're dealing with a very specific kind of exhaustion, a specific kind of debility, one that hits the brain center's first thought before it really gets to the muscles in a big way.
The sources are clear on that.
Absolutely, crystal clear. The muscles seem strong, the sources say, even after the mind is basically checked out. The person might genuinely insist, no, I'm all right physically. They might even feel this odd urge to be active.
Maybe to escape the mental fog.
Quite possibly. They might walk for miles, do physical chores, exercise hard. But that mental apathy, that cognitive shutdown, it's profound. Think about the daily impact.
Yeah, what can't they do?
Okay, so they cannot add up a column of figures. Simple math. Impossible. They cannot read the newspaper and carry the trend of thought. So no sustained focus, no following sequences. They cannot connect circumstances. Linking ideas, cause and effect, gone.
That's huge.
It is. And in really extreme cases, they might even forget the names of those in his family or clerks they see every day. This isn't just, a brain fart or being distracted.
No, it's deep.
It's a deep, pervasive inability to engage with basic mental processes. And the sources say this state can pop up in both acute and chronic illnesses, but also from non-physical things.
Like what?
Like long, intense studying, years of prolonged worry in business, that constant mental churn of anxiety, or even, interestingly, in feeble schoolgirls who become relaxed from very little effort.
Suggesting a vulnerability?
Exactly. Suggesting maybe a certain innate sensitivity, maybe they're predisposed to mental overload. The mental function just shuts down. Even if the body seems okay to keep going, it really highlights this often ignored dimension of mental exhaustion.
So, if the mind is that fundamentally tired, almost like you said, paralyzed, what does that actually look and feel like inside? Emotionally, intellectually? It sounds like more than just fatigue. It's like a whole inner landscape changes.
It is. It's a total transformation of their inner world. And the sources, they paint a really detailed, quite poignant picture of this mental and emotional state.
Okay.
First, there's this overwhelming apathy and indifference. The person is described as quiet, unwilling to speak, like words are just too heavy, too much effort.
Or they might talk fast. You mentioned that.
Paradoxically, yes. If they do speak, it might be this hasty speech, sort of forced, brittle, lacking any real engagement. They become indifferent to everything.
Everything.
Pretty much. Little interest in surroundings, loved ones, even their own worsening condition. And it's not coldness, the sources clarify. It's an apathy born from unequal struggling with adverse circumstances, mental and physical.
So it's overwhelmed.
It's being utterly crushed by life's struggles. Their spirit is just ground down. The mind becomes profoundly obtuse or torpid, dull and sluggish. And this gets even worse if they also have persistent diarrhea or excessive sweating, which, as we'll see, are key features too.
That sounds incredibly isolating, to be so mentally wiped you can't even connect with the world or the people you love.
Precisely. And that leads right into the profound cognitive slowness. They have a slow grasp, the sources say. New ideas, simple instructions, they just don't land quickly. It's like thinking through treacle.
Difficulty finding words.
Big time. Cannot collect his ideas, hunts for words. That speaks volumes about the struggle just to verbalize, to organize thoughts. And their poor memory, it's less about forgetting the distant past and more about this inability to hold on to new information, access current stuff, follow a train of thought.
And emotionally, beyond the apathy.
Emotionally, there's this heavy weight, settled despair, a pervasive hopelessness. They feel this deep dread of future, this foreboding about tomorrow, and they tend to brood over one's condition, getting stuck in this loop of worry and self-pity that just digs the hole deeper.
Are there specific behaviors, outward signs that show this inner state?
Yes, quite a few, and they're good clues. Besides just not wanting to talk, they answer reluctantly or slowly, briefly, incorrectly. It shows the massive effort needed just to form and say something.
And it works?
Interestingly, the sources mention hysteria at change of life, suggesting maybe a particular vulnerability during big hormonal shifts or life transitions when the nervous system is already stressed. There's also homesickness with inclination to weep, which kind of reveals this deep, almost childlike emotional sensitivity underneath the apathy, a real longing.
And in more severe cases,
You might see a mild delirium easily aroused, meaning they can be briefly brought back to awareness, but they quickly drift off again into this clouded, dreamlike state. And underpinning all of this, really central to the whole picture, is what the sources call brain fag.
Brain fag. Sounds descriptive.
It really is. And it's not just a casual phrase for feeling tired. It literally means a brain that is so tired and exhausted, it just can't function properly anymore. It's profoundly worn out, like an engine out of fuel.
Okay, it's crystal clear this mental exhaustion isn't just a side effect. It's the main event, the starting point.
Yeah.
But what gets someone there? What kind of powerful events or forces bring this on? The sources mention some pretty intense triggers, right? Things that seem to drain the very life out of a person.
They do, and they're remarkably specific about where this deep debility comes from. Often, it ties directly back to depleting the body's vital reserves.
Vital reserves.
Yeah, one of the main recurring causes is the loss of vital fluids. This is a huge theme, a major worse factor for Phosphoricum acidum. And in the context of these older sources, vital fluids isn't just about, say, dehydration.
It's a more symbolic.
It's conceptualized as a literal draining of the body's fundamental energy, its life force. So this includes things like sexual excess, seen as depleting nervous energy and physical resources.
Okay.
Also, prolonged nursing, especially for a long time or with twins. That's seen as a massive sustained drain on a woman's system, leading to this kind of exhaustion.
Makes sense.
Any kind of hemorrhage, especially if the blood is dark, even chronic profuse urination or excessive sweating, all these things contribute to this generalized depletion. It's like the body's core vitality is just slowly leaking away.
That suggests something really deep, almost like the life force itself is literally being drained by these intense physical or emotional demands, leaving someone hollowed out.
Absolutely. And beyond the physical fluid loss, the emotional and mental side is huge, often devastating. Grief and emotional trauma are massive triggers here, almost defining.
Like what specific?
The sources list the ill effects of bad news, the crushing weight of disappointed love, deep, lingering grief, the bitterness of chagrin, that feeling of humiliation or vexation, the shock of injuries, deep mental shock of any kind. Basically, any intense, prolonged emotional storm that really shakes a person to their core.
So specific types of grief, too.
Yes, they specifically call out unhappy love and the deep ache of homesickness. The sources state it directly. Ailments from care, grief, sorrow, chagrin, homesickness, or disappointed love, particularly with drowsiness, night sweats towards morning, emaciation.
Wow. Drowsiness, night sweats, emaciation linked directly to grief.
It shows that profound mind-body link in this profile. Emotional pain translates directly into this tangible physical decline. It's as if the suffering itself consumes the life energy.
So it's not just feeling sad. It's a physical breakdown, a wasting away because of emotional pain that's maybe too big or hasn't been dealt with.
Precisely. And then there's also overexertion and acute illness. Someone can become just overtaxed mentally and physically, pushed way beyond their limits, leading straight into this state.
Right.
Being ravaged from acute diseases or having a really long, difficult convalescence after fever that can deplete reserves to this level too. And like we touched on, long study, intense mental effort, and prolonged worry in business are specific kinds of overexertion that fit the bill.
And it leads to that wasting away.
Yes, all these factors contribute to what the sources call pining with emaciation. The person literally becomes withered in the face, looking drawn, aged. They experience this gradually increasing weakness and emaciation. It's a cruel twist.
Yeah.
The mind goes first, and then the body, even if it seems strong initially, slowly follows, wasting away from these intense, unrelenting drains.
So as this deep weakness, this debility takes hold and the body's energy fades, the sources describe a whole cascade of physical symptoms. What are the key signs that this profound weakness is spreading through the body beyond just that initial brain fog?
Yeah, the physical signs become really pervasive, telling the story of systemic depletion. There's a general weakness and debility common to all acids, meaning that profound lack of strength you see with acid remedies, but it's very marked here.
More than just tired.
Oh, much more. It's a deep intrinsic weakness, almost a paralytic feeling, described as so tired in the back, so tired in the muscles, so tired all over, a paralytic weakness. Imagine just the sheer effort needed to move, even if the muscles aren't technically damaged.
And a lack of response.
Yes, a notable lack of reaction. The body just struggles to rally, whether it's fighting off illness, healing an injury, or even responding to treatment. It's like the body's ability to adapt has broken down.
Wow.
It's as if the vital spark, the engine for self-repair, repair, is so depleted that the system just loses its ability to respond. It's left in the state of deep, unresponsive inertia.
So not just weak, but unable to bounce back.
Yeah.
A really deep systemic depletion. Where else does this show up really clearly?
It hits the sexual system hard, reflecting that depletion of vital fluids and nervous energy we talked about.
Okay, for males.
For males, the sources describe weak, relaxed genitals suddenly during coitus, preventing emission. So a sudden loss of erection or inability to finish. There's weakness and pollution after coition, meaning they feel much weaker after sex. And nightly emission with lascivious dreams, which is another way vital fluids are seen to be lost.
Loss of function, too.
Critically, yes. No erections, penis becomes relaxed in the midst of an embrace and he cannot finish the act. A profound loss of virility, also a general aversion to coition, and loss of sexual desire.
Any other specifics?
Prostaturia when passing a soft stool, which is an involuntary discharge of prostatic fluid, and immediately after every erection, discharge of prostatic fluid. Plus related skin issues like herpes preputialis, eczema of scrotum, and psychotic excrescences, which are like wart-like growths.
And for females?
For females, the picture includes a uterus bloated as if filled with wind, which must feel awful. Menses too early and too profuse, with pain in the liver suggesting hormonal imbalance and more blood loss. Itching yellow leukorrhea after menses, another depleting discharge.
And the nursing connection is key here.
Absolutely key. Health deteriorated from nursing, especially prolonged nursing or nursing twins, is highlighted as a major trigger, a massive, sustained drain on the mother. Other symptoms include sharp pressure in left mama. Interestingly, infants vomit milk constantly, suggesting maybe the mother's state affects the milk quality or the baby somehow, and dysuria during pregnancy, which is painful urination. It all fits the bigger picture of systemic exhaustion.
That's a huge impact across the sexual system, tying right back to that vital fluid loss idea. What about other really striking physical signs? You mentioned hair loss earlier.
Yes, hair loss is a very striking feature, a strong visual clue to this state. The hair thins out, turns gray early, showing that premature aging, that lack of vitality.
Just on the head.
No, and this is key. There's a generalized falling of hair, but specifically the sources say falling of the hair from the genitals, whiskers, eyebrows, head. It's systemic, not just your typical male pattern baldness. It suggests a deep lack of nourishment right down at the hair follicles.
And the sources compare this.
They do, which is really helpful for diagnosis. They say Phosphoricum acidum is closely related to nature myrrh and selenium in falling out of the hair. They note that selenium has falling out of the hair from the head, eyebrows and lashes, beard and genitals from all over the body, so even more widespread. Whereas nature myrrh causes the hair to become very thin. During confinement, the hair falls from the genitals, suggesting maybe a more specific trigger and location for nat myrrh. This kind of detailed comparison helps nail down the specific pattern for Phosphoricum acidum. It points to that deep systemic depletion.
That's a fascinating level of detail, really specific. And what about bones and joints? Does this weakness go right down to the structure? It sounds like it might.
It absolutely does. The skeletal system feels it too, but in a different way, a different kind of deep ache. The sources mention bruised soreness, like growing pains, but persistent, not just temporary.
Serious bone issues, too.
Yes, it's indicated in serious bone diseases, osteitis, bone inflammation, periostitis, inflammation of the bone covering, and caries, bone decay. Also in rhititis or rickets, which points to a fundamental breakdown in nutrition or metabolism.
And the pain itself.
Can be a gnawing pain in bones, deep and irritating. There can be loose joints suggesting structural weakness. But here's a very specific, almost unique characteristic. Periosteial pains, bones ache as if scraped.
Ouch.
Ameliorated by motion. When lying, the pain shifts to side lain-on. That shifting pain when they turn over, and the fact that motion makes it better, which contrasts with the mental state wanting stillness, that's quite specific.
Okay, motion helps the bone pain.
Yes. Also, pains in the long bones between the joints, better by motion. And pains in the tibia at night. Bone feels as if scraped, like something rough inside. Even spondylitis of cervical vertebrae, neck, spine inflammation, and pain in the hip joint are mentioned. It's a deep, persistent ache, like the body's very framework is being worn down by this pervasive weakness.
And there was a really specific physical detail, almost a diagnostic marker that stands out in the sources, something about the urine.
You're absolutely right. It's a clinical sign that, if you see it, can be pretty definitive. In many complaints linked to Phosphoricum acidum, a really marked peculiar feature is milky urine.
Milky? How so?
Sources describe it quite clearly. Sometimes it is milky when passed, so it looks cloudy, opaque right away. Or you might see milky flakes in the urine, like little particles.
Or it changes.
Or sometimes the urine becomes milky on standing, like flour, chalk, or phosphate deposits stirred up in it, meaning the milkiness appears as it settles because these substances precipitate out.
What causes that?
It points directly to a condition called phosphaturia, basically. Too much phosphate being excreted in the urine, giving it that cloudy, milky look. Interestingly, the sources mention this alongside diabetes, maybe suggesting an old understanding of a link to metabolic issues involving sugar or phosphates.
Any other details?
Yeah, for men, these milky flakes can apparently even clog up the urethra, causing urination problems. And for women, there's a specific note about whey-like urine shortly before menses, tying it again to fluid balance and the overall state of debility. It's a visual cue that says a lot about what's going on inside metabolically.
Okay, now for what might be the most fascinating and honestly completely counterintuitive part of this whole picture, the sources talk about a specific kind of diarrhea. But instead of making the person weaker, which you'd absolutely expect.
You'd expect collapse from major fluid loss.
Exactly. But here, it apparently brings relief. That just turns common sense completely upside down.
It is genuinely paradoxical, and it's such a crucial, almost diagnostic symptom for getting the unique internal logic of this state. The description is super precise. Profuse, painless, dirty white, watery, or lyenteric stools, but little debility.
Okay, break that down.
Okay. Profuse, meaning a lot of it, large quantity. Painless, this is critical, no cramping or griping like you often get. Dirty white or whitish gray like dirty white paint, that's the unique color, very different from other diarrheas. Watery or lyenteric, meaning undigested food, so digestion is off.
And no smell.
Crucially, yes, the sources emphasize it. Stools odorless. Now, you'd absolutely think with that much fluid pouring out, continuously.
Total collapse, dehydration, weakness, feeling awful.
That's what logic dictates. But here, the complete opposite happens. From the quantity, it would seem that the patient would be exhausted, the sources say, but instead there is little debility or even no marked debility or exhaustion.
Seriously, no exhaustion.
Little to none. The classic example they give, it's almost touching, is a child with the stool. The little one smiles as if nothing were the matter. The mother's baffled, wondering where it's all coming from, but the child seems comfortable, free, even happy.
That's incredible. So it's not just that it doesn't make them weaker.
Yeah.
It actually helps them, makes them feel better.
Yes, exactly. That's the profound paradox. The sources state it clearly. The phosphoric acid diarrhea often ameliorates many of the symptoms, and the patient feels better. It's described as a chronic diarrhea, copious, thin and watery, whitish gray, and the patient feels comfortable, free, and happy.
Wow.
This is huge. It's this massive involuntary discharge that, for this specific constitution, brings genuine well-being, relief, lightness, not more depletion. It's like the body's desperately trying to get rid of something, and this particular diarrhea is the lucky escape route.
That's truly remarkable. And I remember the sources had a really strong warning about trying to stop this symptom, right? Like it's a vital release valve.
This is where understanding the logic is absolutely critical. The sources give a very grave warning. They say, if a diarrhea comes on, then the chest trouble is averted, implying the body is finding an outlet.
Okay.
And conversely, this is crucial. Most awful results will ensue from the use of astringents or any remedy that will stop that diarrhea. They say suppressing this beneficial discharge can lead straight to much deeper problems.
Like what?
Like tuberculosis, difficult respiration, coughs and suffers in the chest, and the trouble culminates in structural changes in the lungs. It highlights this profound idea. For this state, the diarrhea isn't the disease to be stopped, it's a compensatory mechanism. A valve the body uses to get rid of deep imbalances or toxins, preventing worse, deeper illnesses.
So stopping it forces the problem deeper.
Exactly. It forces the illness deeper into the system, leading to much worse outcomes.
It's almost like the body's choosing the lesser evil or finding its own weird but effective way to heal.
Yeah.
Are there other diarrheas that could be confused with this one since it's so unique?
Excellent question. Differentiation is key. The sources explicitly contrast it with others. For example, podophyllum also has copious watery stools, but critically, podophyllum comes with a horrible stench, a really foul odor, and great prostration. The patient feels incredibly weak, looks like they're dying, and the stool is yellow.
Okay, different smell, different color, different effect.
Totally different. Phosphoricum acidum. No stench, little prostration, whitish gray stool. brings relief. Another comparison is Graciola, similar prostration, but the stool is green water, often thick like green bile. Again, different color, different consistency.
So the Phosphoricum acidum one is really distinct.
Its painless, non-prostrating, whitish-gray, odorless stool that brings relief is its absolute hallmark. The sources also mention if diarrhea comes specifically from eating acids like sour wine, consider Antimonium crudum. It just shows how nuanced these distinctions are.
Okay, beyond these huge defining features, the mental collapse first, the paradoxical diarrhea, the sources also detail really specific sensory sensitivities and the things that make symptoms better or worse. These modalities, they really flesh out the picture, don't they? Show how fragile the system is.
They really do. A big area pointing to a nervous system that's just profoundly sensitive, almost overloaded, is sensory overload. The person is sensitive to light, sound, and odor, which takes away her breath.
Takes their breath away. Wow.
It's visceral. Sensory input feels suffocating. There's marked photophobia, intense aversion to light. Normal room light can feel blindingly painful. Severe intolerance of noise, especially music, which causes stitches like sharp, piercing pains, even while singing himself.
Even their own singing hurts.
It highlights how extreme the nervous sensitivity is. Every sound re-echoes loudly in the ear, creating this horrible internal echo chamber. They might get a shrill sound in ears on blowing nose, even illusions of hearing, like hearing a bell pealing when there's nothing there. It's a nervous system totally on edge. Normal input becomes painful, overwhelming.
That sounds like torture, a constant assault. How does this tie into headaches? I imagine they get bad headaches with all this going on.
You're absolutely right. The headaches are totally tied into this sensory and mental fragility, almost like an extension of that brain fag. They feel like crushing weight on vertex, like immense pressure on top of the head, or pain as if temples were crushed, a tight, vice-like feeling, and predictably, it's worse shaking or noise.
Any other headache types?
Yeah, a sensation of pressure as from a weight in head from above downward, like something heavy pressing on the brain. These headaches are definitely worse from motion, talking, and light, reinforcing that sensitivity and the need for stillness. They're fundamentally associated with mental weakness, brain fag. They either come from or worsen that profound mental exhaustion.
Vertigo, too.
Can be. Vertigo with ringing in the ears and glassy eyes, disturbing balance and perception. And specific triggers highlighted include schoolgirl's headache from overuse of eyes, direct link to mental strain and headaches after coition, tying back to that vital fluid depletion idea again.
So given all these unique, often paradoxical symptoms, what are the big picture things that consistently make this state worse, the aggravations? And what, if anything, brings even a little bit of relief? Understanding these is key, right?
Absolutely. The sources are very precise about both aggravations and ameliorations. They give critical clues. The worst factors, many we've touched on, really reinforce the core issues. Top of the list, loss of fluids.
Right, the big one.
Whether from sexual excess, prolonged nursing, hemorrhage, any of it drains the reserves, makes the debility worse. Fatigue, mental or physical, huge aggravator. Convalescence after fever, if not managed well, because the body's already depleted.
And emotions.
Massive. Emotion, grief, chagrin, mental shock, that deep in homesickness, unhappy love, all significantly worsen things, confirms how deeply emotions hit the physical state here.
External factors.
Critical too. Exposure to drafts, cold, consistently makes it worse, shows a real vulnerability to chill. Sensory inputs, like music, and especially talking, are aggravating, reinforces that aversion to communication, that sensitive nervous system.
Even just sitting or standing.
Yes, sitting and standing can worsen symptoms. Maybe a lack of core vitality makes static positions hard. Overlifting, the shock of an operation, chronic fright, also powerful triggers. Basically, any kind of exertion, mental or physical, is bad news. And specific timing, like morning headaches, plus a general sensitive to cold weather, these things just push them deeper down.
That's a clear picture of what drains them more. What about the flip side? What actually helps, even for a moment? Any paradoxes there, too?
The better factors are also distinct and show how the body seeks relief. Warmth generally helps. Comforts a system that feels chilled or sensitive. Short sleep is noted as surprisingly helpful for the weakness.
Short sleep, not long sleep.
Yeah, suggesting maybe deep, long sleep isn't happening, but even brief periods of unconsciousness offer some immediate, temporary benefit. A quick recharge, maybe. Oh. Crucially, passing stool, that specific relieving diarrhea we discussed, is a major better factor. It's a discharge that brings comfort. For those weird bone pains, motion actually helps, which is odd given how general exertion is bad.
Right, the opposite.
suggests maybe a different mechanism for those pains. And finally, profoundly, absolute quiet and being alone at peace, highly beneficial, reflects that overwhelming sensory and mental fatigue they need to withdraw. Oh, and for the bone pains, when lying, the pain shifts to side lean on, so changing position can bring temporary ease. Subtle, but important. These betters give vital clues for identifying the state and understanding their needs.
Okay, let's zoom out again. From the specifics to the overall physical picture, what does someone needing this remedy generally look like? What's their appearance? And what kind of unusual sensations run through their body reflecting this deep weakness?
The sources paint a really specific, almost, haunting picture of their appearance. There's a distinctive, pale, sickly face, often lusterless, no vibrancy. Eyes are glassy, staring, sunken, often with blear rings around them.
Like deep exhaustion.
Exactly. In more severe states, like during fever, you might see a Hippocratic countenance. That's an ancient medical term, right?
Yeah, from Hippocrates.
Describing a face that looks sunken, pinched, pale, almost death-like. It's a critical sign of profound systemic exhaustion, vitality hitting rock bottom.
Other signs.
Discolored lips covered with swords becoming very black. Swords are those crusts on teeth and lips in bad fevers, points to serious debility. In extreme cases, external parts become black. Senile gangrene, showing circulatory failure, lack of life force in the extremities. The skin itself, often withered, old, and gray. The person looks emaciated, thin, wasted away, fitting that pining description.
But they can still have skin issues.
Yeah, paradoxically, things like pimples, acne, blood boils can still appear on skin that feels clammy, wrinkled. Like the body's confused attempts at elimination are still happening amidst the debility.
So they look profoundly exhausted, almost aged beyond their years. What about the internal sensations, the weird feelings?
The sensations are just as distinctive. Give you a window into the internal distress. There's a pervasive sense of pressure, weight, felt everywhere, forehead, sternum, vertex top of head, eyes, navel, breasts. A feeling of being physically and mentally weighed down.
Anything really unusual?
Yes, formication. That crawling, tingling feeling. Described as being at root of hair along the spine and limbs, over whole body, especially where there is hair, as if in the roots of the hair. Like ants crawling just under the skin, especially in hairy areas, indicates nerve irritation.
What else?
A general feeling of bruised soreness, like a persistent body ache. They report coldness of parts, maybe one side of the face or the abdomen, especially during fevers. Shows uneven circulation, maybe, but also, paradoxically, intense burning below waist, burning in kidney region, burning along the spine, suggests localized inflammation or nerve irritation alongside the coldness.
Motor symptoms.
Yeah.
Numbness.
Yep. Cramp-like pressure in arms, hands, and fingers. Numbness along radial nerve affecting the forearm, hand, and they stumble easily and make missteps. Shows a subtle lack of coordination despite the muscles maybe seeming strong, a disconnect between brain and body.
And the pains themselves are specific too, you said, not just general aches.
Exactly. The pains have really peculiar qualities. Pains go to part lane on. So if they lie on their left, the pain moves left. Turn over, it moves right, like it's fluid or shifting. Very unusual.
And that scraping feeling.
Yes. Pain at night as if bones were scraped, or as if a rough instrument were dragged over the bones. Imagine that raw, grating feeling deep inside, excruciating. These pains seem deep-seated, often along the nerves, but especially along the long bones. The sources really emphasize severe bone pains, particularly pains in the tibia at night, the shin bone. Not superficial muscle pain, this goes deep, reflecting that profound structural weakness.
Okay, beyond the general picture, how does this deep weakness show up in specific body systems? Let's get into the nitty-gritty of individual organs and their peculiar ways of expressing this state.
Right, the debility seeps into every system, but with these characteristic quirks. In the eyes, there's pain as if eyeballs are pressed together and into head, or a feeling that the eyeballs feel large, indicating intense pressure. They might have yellow spots on conjunctiva, the eyelid lining, suggesting other issues.
Vision issues.
The sources mention loss of vision from masturbation, linking back to that historical idea of vital fluid loss from sexual activity. They might even see rainbows of visual disturbance.
The nose.
For the nose, bleeding, epistaxis, another fluid loss, persistent itching, making them bore fingers into nose. The nose swollen with red patches or pimples on tip suggests localized inflammation or poor circulation.
And mouth and throat, vital areas.
In the mouth, bleeding, swollen gums that retract from teeth, showing the roots. Poor gum health, maybe scurvy-like signs. Teeth become yellow and feel dull, losing vitality. Tongue can be slimy or have that distinctive red streak in middle, hinting at inflammation.
Anything really strange?
This is odd. They bite sides of tongue involuntarily in sleep, a sign of nervous irritation, maybe even minor seizure-like activity during rest. Mouth dry, lips dry, cracked, often with those sores and fevers. Can have painful nodosities on the gums, small hard lumps, and a really unpleasant taste of rotten eggs, pointing to digestive issues. The throat can be dry, and they might hawk up tough mucus, hard to clear.
Moving down to the stomach and abdomen, how do they handle food in this state? Any weird cravings?
The stomach often rebels, but yeah, specific cravings. A strong craving for refreshing and juicy things, which makes sense maybe with internal heat or dryness. And a peculiar craving for cold milk. Big time. Significant acidity. Sour food and drink disagree, often just sitting there, fermenting. A pressure as from a weight in the stomach, heavy feeling. General loss of appetite. In the abdomen, aching in umbilical region near the navel, distension and fermentation with loud rumbling, a feeling of coldness, poor digestion, gas. The liver seems to be too heavy, painful during menses, suggesting congestion. Flatus is offensive, garlicky, hinting at gut imbalance.
And that sinking feeling.
Yes, that striking symptom, a sinking sensation in the abdomen after a normal stool, emphasizes that profound emptiness or maybe relief after that specific discharge, like energy being drawn away from the core.
And the respiratory system. You mentioned earlier that chest problems could be avoided by that specific diarrhea. That's a big connection.
It really is. The respiratory system shows a weak feeling in chest, that deep internal fatigue, predictably worse by talking, coughing, or sitting, things requiring effort or stillness. But paradoxically, ameliorated by walking. There's that weird improvement with motion again.
Other chest symptoms.
They might take cold easily, and strangely feel better by a draft on chest. Another counterintuitive thing, a spasmodic tickling cough, irritating, not very productive. Can feel pressure or twisting behind the sternum, rendering breathing difficult. A constricting feeling. The expectoration salty, peculiar taste.
And if the diarrhea is stopped?
Then the source is warned as the debility progresses of a dry, hacking cough, ataral conditions of the chest, leading potentially to serious lung issues like tuberculosis with that pallor with gradually increasing weakness and emaciation. Could be infiltration at the end of pneumonia, lungs staying dense, even hemoptysis, coughing blood, showing severe damage.
And the heart, the center of vitality, how's it affected?
The heart can be really impacted, reflecting the whole system's exhaustion. Palpitation, noticeable, often irregular heartbeat, especially in children and young persons who grow too fast, suggesting strain, or after grief, direct link to emotional trauma. Also after self-abuse, masturbation, tying back to fluid loss again.
The pulse.
Pulse is irregular, intermittent, often weak, thready, shows the heart struggling for rhythm and force. Sources note prolonged fever ending in feeble heart. The heart itself gets exhausted by long illness. Even palpitation during sexual excitement shows that fragility, the energy drain.
What about general fevers? How does the body handle illness in this state?
The sources emphasize that low fevers must be studied closely here. They reveal a lot. Complaints come on slowly, slow decline, slowly increasing prostration. It's gradual, insidious weakness. They describe symptoms like advanced typhoid, that severe, debilitating fever.
Like what specifically?
Extreme prostration, totally limp, unresponsive, a tympanitic abdomen swollen with gas, dry brown tongue, often coated, those swords on the teeth. The person is gradually approaching unconsciousness, drifting, seeming to die of exhaustion. Peculiar. Starts with little thirst, then ramps up to intense thirst, with craving for much water during perspiration. They just want to be let alone. Absolute need for stillness. They look at the questioner with glassy eyes, as if slowly comprehending. Pupils contracted or dilated, eyes sunken, that Hippocratic countenance.
Bleeding too.
Yes, continued fever, bleeding from the nose, lungs, bowels, hemorrhage from any mucous membrane. Shows the systemic fragility, the constant fluid loss. Prostration gets worse until the jaw drops. Extreme muscle weakness. Patient seems to die of exhaustion. Also, a tendency to abscesses after a prolonged fever, weak immune response.
Temperature fluctuations.
Yeah, parts can feel cold, one side of face, abdomen, while other areas have heat with sweat. Profuse sweat, worse at night as a sequel, continues the depletion, described as sluggish, painless fevers, highlighting how sneaky and non-reactive they can be.
And finally, the skin, the body's outer layer and sleep. How do they reflect this whole state of weakness and the struggle for balance?
On the skin, you see signs of deep tissue weakness. Painless ulcer with stinking pus, suggesting the body can't even mount a strong inflammatory fight. A tendency for boils, abscesses, pustules, and other moist eruptions as tissues become weak, prone to infection.
Bed sores.
Basically, yes. Red spots appear wherever the flesh is thin over the bones, like shins, elbows. These spots become inflamed and form open ulcers, pressure sores, poor circulation breakdown. Also, ulcers on the legs with watery, offensive discharge, more chronic draining.
Bruising.
Yes, large purple spots form on the skin and extravasation of blood from the capillary veins. Ecchymosis, big bruises showing fragile capillaries, poor clotting, other things. Carbuncles, boil clusters, warts, chilblains, wenses, corns with stinging and burning and parts become black, all pointing to feeble circulation in the skin.
And the overall skin look.
Generally, skin withered, old, and gray, matching the emaciation and premature aging. Itching between the fingers or in the bend of joints or on hands is common too, plus recurring herpes, eczema, erysipelas.
And with all this profound weakness, mental fog. Can they even get the restorative sleep they obviously need so badly?
Not really, not in a truly deep restorative way. The sleep pattern is classic disruption. Sleepy by day, constantly drowsy, can't stay alert, but then paradoxically, hot and wakeful at night, can't find that deep, continuous rest.
But they can sleep deeply sometimes.
During fever, sleep can be deep, but when aroused, fully conscious, meaning they're not totally disconnected. And like we heard earlier, that odd thing, short sleep ameliorates weakness. Suggests the quality is poor, but even brief moments of switching off offer some temporary relief from the overwhelming burden. A tiny, fleeting break.
Wow, what a deep dive. What an incredibly complex picture. So to kind of wrap up, what really stands out about Phosphoricum acidum, it's that incredible priority of mental exhaustion before the physical strength gives out.
Mind collapses, body tries to push on.
Right. And we saw the devastating physical toll of deep grief and that insidious loss of vital fluids just draining the life force away. And maybe the most mind-bending part, that counterintuitive relief from specific, often huge discharges like that characteristic painless diarrhea.
Yeah, totally backwards from what you'd expect.
It just hammers home this powerful, often hidden connection between our inner world emotions, thoughts, and how they show up physically.
It absolutely does, profoundly. This deep dive really shows this undeniable, almost startling holistic link. It kind of forces us to rethink how often we separate mental and physical health in our usual way of thinking.
Right.
It challenges us to see symptoms maybe not just as problems to stamp out, but as expressions, sometimes desperate attempts by the body to find balance, which raises a big question for you listening. How might recognizing these really specific detailed patterns like mental weakness coming first or a horrible seeming symptom actually bringing relief, how might that change how you understand weakness or recovery in your own life or maybe in people around you? How might it shift your whole idea of what true health or true depletion even looks like?
And that leaves us with this final, really provocative thought to chew on. Given how the body sometimes finds these surprising, sometimes frankly unpleasant ways to discharge illness and try to fix itself, like that incredibly relieving massive diarrhea.
Right.
What other seemingly awful or even alarming symptoms might actually be our body's ingenious, desperate attempts to find balance, to release something deeper, more profound? It really makes you question all our assumptions about illness and healing, doesn't it? Something really deep to ponder until our next deep dive.